intervention. Go ahead, Alexandre.
No, it was just to make a brief question, because we have also from the European Commission. One of the issues is that, of course, we don't have a common health policy, and the health policy is mostly driven by member states. But are we going to see, for example, but at the market level, we have a common policy. So are we going to see, for example, some fines or penalties to the countries that forbidden exports to other European members of ventilators, PPEs? It's a question.
We should.
Maybe it's a question that Professor Adalberto Campos Fernandes would like to answer.
So, thank you very much for this fantastic talk. Yes, I agree with Alexandre Lourenço in most of the statements that he produced, but I believe that the key words are now cooperation and collaboration, not only between academia, research, but also at the political level. We all know that the treaty does not allow that the European Commission takes a position in national health policies, but it is the moment, right? And Gerard Bourbon gave a very interesting example, like a military exercise, because we are now globalized, but we are not coordinated. And this is the good moment to have some insights and some tries to prepare the new pandemic and the new epidemic phenomena, because you all know that COVID-19 is not the last of the virus that we have to face in our lives, but probably the next virus will be worse than this one. So collaboration, cooperation, and probably more commitment in ethical terms, because Europe is washing their hands all the time concerning the national health service and the national health policies. And the experience that Sweden has now, and at the beginning the United Kingdom has also, shows us that it is not only necessary to have nice people, nice cultural and educational level, nice health systems to commit some mistakes. And Sweden is a bad example now, but Austria and Germany are good examples. So it is necessary to build a collective idea in Europe that health systems and health delivering is key issue for the human development in Europe, and not to close the doors and close our minds with the classic excuse that the treaties say that the national health competencies must not be invaded by the European intervention. So I follow Alexandre, I follow Patricia. It is now the time to strengthen the efforts to prepare the new pandemic, to prepare the new threat, and we hope that in the next few years we'll be much more prepared with more investment and with more finance for investigation, but also for delivering of healthcare in all countries in Europe. Thank you very much.
Thank you so much.